Hi, Charlotte Smith here with Bladen Online. I am at the Bladen County Courthouse in the operations room, and I'm with Bladen County Emergency Service Director Nathan Dallas and Bladen County Health and Human Services Director Dr. Terry Duncan. Thank you guys for joining us.
Thank you for coming up.
Thank you, Bud.
We are here. We're going to have some time for questions and answers because we've had some people asking different things out in the community, and you two have offered your time, and we appreciate that. Can you tell us, have there been any confirmed positive cases of COVID-19 as of to date here in Bladen County?
As of right now, there are no positive cases in Bladen County. There are 398 positive cases as of 11 o'clock this morning. The North Carolina Department of Public Health and Human Services updates that site by 11 every day. There may be some people that are seeing differences between what the CDC or the World Health Organization is posting, and that's because the North Carolina site is updated once daily.
Mm-hmm.
So while there are no confirmed cases, there are people that do have symptoms, and we are continuing to work with providers on testing. The health department has the ability to test, the providers have the ability to test, but the guidelines have changed some on that testing.
And so what are the new guidelines?
So the new guidelines are for anyone that has mild symptoms, that's fever and any respiratory difficulty or any respiratory symptoms,
Mm-hmm.
that they not be tested. And that testing is reserved for those people that might need medical care and or some high-risk populations, those people that have heart disease, lung disease, other respiratory illnesses, pregnancy, and even all of them do not require testing.
Okay. So what about the higher risk people, the people that are 65 and older or live in a nursing home or a long-term facility? What are the high-risk conditions?
Well, the high-risk conditions are just those, that you may have other medical issues,
Mm-hmm.
or you live in a conjugate living place or working in healthcare. So that makes you high risk.
Like chronic disease, heart disease, compromised immune
Correct.
system, that kind of thing.
Correct.
Okay. And some people seem to think that Bladen County does not have the tests available to be able to tell if a patient does have the coronavirus or not. Is that true?
That is not true. We not only have the test, but we have performed tests at the health department and in the local facilities. Right now, when the crisis actually started, providers that were going to do a test actually reported it to the health department that they had performed a test. Guidelines changed toward the end of last week, and they no longer have to report that unless it is negative. They do not report initially to us that they have performed the test. Only if the test then is positive,
Mm-hmm.
are they going to report it to us. So we have people that are actually calling the health department that are wanting to know what their test results are. And we do not know yet that they have been tested, and would not know unless the provider lets us know that they've been tested first of all. But they are required by law to let us know if they test positive.
Now, would they let the patient know first, or would they let the health department know first?
That would depend on the provider.
Okay, so it's not a policy in place where first you contact the patient and then, okay, so say a patient does test positive. So are they being quarantined?
Yes,
Or
and we will follow those patients that we are made aware of that first of all are being tested. We're going to make contact with them, and we're going to follow them.
Mhm.
Those patients that test positive, we will follow them even a little more closely.
But we have no patients in Bladen County that have tested positive.
No
At
patients
this time.
tested positive.
If they go to a provider outside the county but they live in the county, are those still reported to you?
Yes.
So that is, even if they went outside the county and got tested, we have no positive COVID-19 cases here in Bladen County.
Correct.
Okay.
And we have received reports from multiple counties where our residents were tested.
Mm-hmm.
We have received those early on,
Mhm.
and those have been confirmed as negative at this point. It continues to take around 4 to 7 days, depending upon which entity's testing it, for us to get results back, or for the provider to get the results back.
Okay. So I'm going to ask a question that I've heard a lot lately is, what's the difference in COVID-19 and the diseases and viruses that we've dealt with in the past, like H1N1 and the swine flu and those, and even the flu now? What makes this such a pandemic? Why is everything closing down? What's the difference?
The difference is that it's virulent. It's a very strong disease, and it can cause the respiratory system to get sick so quickly.
Mm.
And the number of people that would be affected by it would make our healthcare organizations would not be able to take care of them all at one time. So what we want to do is to try to flatten that curve, so that as people become sick, that we can care for them in our healthcare facilities.
And how are our healthcare facilities here? Are they overran right now? How are things at our healthcare facilities?
We're in constant contact with the healthcare facilities, and the hospital nursing homes here are doing very well at this point. The hospital is not at capacity, and currently has not had anyone that is positive, just as we have reported earlier. There are no positive cases in Bladen County.
Mm-hmm. And yesterday, the governor ordered that some businesses that are not considered non-essential but cannot distance themselves socially very well be shut down. Salons and barbers, the North Carolina State Board has said it's going to be at least 30 days. What should people do that depend on getting their hair done every week? What are those, and a lot of those are elderly people, so what are they to do? Do you have an answer for that?
And that is a concern, particularly for our positive self-image, both not only for the elderly but for the younger population as well. And the state does not have any recommendations as of now. Of course, as a woman in her older years, there are such things as dry shampoo and others, but as of this point, I do not have recommendations.
Okay. And for the emergency services, have you guys seen any cases of people being over anxious and causing emergency situations?
No more than we usually do on a daily basis in county. Now we do, our emergency EMS and other workers are taking extra precautions if need be. With that being said, Dr. Duncan, we don't have any positive cases in Bladen County, but we are following our EMD protocols, enhanced EMD protocols that have come down from the state, and they're working. So if we get a call out for a respiratory call or fever or something like that with EMS, we are certainly taking extra precautions as far as our PPE. We have put a protocol in with our law enforcement, our EMS, and anybody going to a call in a house. If we are advising, our communication center is advising people on the phone that are calling in for emergencies and things like that. Some of you that have called in or people might have heard, if you have a law enforcement calling or EMS calling or coming to your house, they're probably going to blow the horn to see if you can get to the door, obviously, so we could triage you outside of the home. Now, obviously, if you're having cardiac arrest or something of that nature where you couldn't get to the door, we're going to go in. But that's just a few of the extra precautions we're taking. But as far as panic or anything like that, no, we haven't seen. We are getting a lot of questions when we're out and about, just because I know citizens are concerned and seem to think that, things we might know more than what we're letting on, and that's certainly not the case. We're sending the information out as we get it, so nothing as far as panic or anything like that.
That's good. I know that during the hurricanes, I've seen people go out. I was actually on the road in Hurricane Matthew when they were driving in the rain, and the road broke and caused a disaster. This is different. This is a different scenario here, but it seems to be getting some of the same responses as far as anxiety and people not knowing what to do, and it of course is breaking routines. So can you explain a little bit the difference and what we should expect?
Yeah, there are a lot of differences. A lot of times in emergency situations, and everyone's different. Every situation is different. What we're familiar with here in southeastern North Carolina are hurricanes, the occasional ice storms, snowstorms, and things like that. And a lot of times people can turn on their TVs if we have power, or listen to the radio, and they know what's coming. We know it's hit Florida before us or another state, and we know that we're going to expect some flooding and things like that. With this type of thing, you hear predictions and things like that, but we're all in uncharted waters and we don't know what to expect. And another big thing is, a lot of times with hurricanes and snowstorms, a hurricane don't affect all of the United States or all of the world. It affects one area, southeastern United States, southeastern North Carolina. So a lot of times in storms, what a lot of citizens don't know, or we put things in place such as swift water rescue teams, strike teams in place from other parts of the state, and in some cases even other parts of the country, come in to assist us, that the public doesn't even know about. We've got those people in place. With this, you can't pull from other areas. You can't pull from other parts of the country, because it's affecting everyone. This is not only a North Carolina thing or a state thing or a national thing, it's a worldwide thing. So there's a lot of resources. Everybody's asking for the same thing, so the resources are stretched thin. It's just, I guess the biggest difference I would say is hurricanes and things like that are somewhat predictable, and we as a public, especially here in Bladen County, have been through several hurricanes. So we've seen in the last 3 years some devastating effects from hurricanes. I would guess that we're used to that. With this right here, our businesses and things like that are shut down for a short period of time, where this seems to be a more stretched out. And I certainly know that there are still a lot of people out there recovering from hurricanes with homes and things like that. But with a lot of our businesses, like you alluded to, with people that rely on getting their hair fixed and things like that, it's changing our everyday way of life. So, and we don't know for how long. I mean, we've got predictions, 30 days, like you said. Schools were closed initially for 2 weeks. Now they're stretched out to May 15th, and could be, we don't know, but they could be stretched out further. So I would say that's the biggest difference, just the period of time our way of life has changed, and things like that. So
Now, talking about the financial effect that it's having on Bladen County, in our community, we do pull from outside of the county, and I'm wondering, these small businesses that are having to close their doors by 5 p.m. tomorrow, and the restaurants that are not able to let people come and dine in, what kind of funding is available? I know that the Small Business Administration and Todd Lyden with our local Small Business Center has sent out some information, and we've published that on Bladen Online. But do you have anything further, any more information? I know they're working on funding in legislation, but do you have any information that you can share?
We've got some guidance, and I'll certainly email that to you. We have got some things in, some of the stuff you've already published and some other things. We got a document from our Senator Tom Tillis on some things they're working on at the federal level to help small businesses and, you know, medium-sized businesses, kind of a Q&A thing that was sent to me, and I've certainly shared that with you so you can publish. And you know, it seems to be in the news, we were talking about it today, that now people are starting to talk about the economic impact of this. And we certainly know, you know, I'm not an economic person, I'm an emergency management director, but I certainly understand the economic impact it'll have on our community, not only our community, but the state of North Carolina and the United States. And I certainly feel for those small businesses. And, you know, as those resources come out, and we're able to share them, we will certainly do that and try to keep those small businesses abreast of what's going on.
Okay. And earlier today, I know that you and your counterparts took donations donated by Bladen Community College to the Bladen County schools to help them with their meals distribution that they're taking to students and their parents across the county with the help of the local churches. And I'm just wondering, what about our seniors? I know that our senior citizens and those nutrition sites have been closed down, and I'm wondering, how are they going to get fed? How are they being fed? Are we sending out buses for that? And do you have a plan in place for that?
We do. Before the center closed, we actually reached out to every resident that was attending the nutrition sites and did get information on where they would be and that they would be home. The BARTS buses are delivering their meals now daily, and we will continue to do that. And also working with, there are people that are traveling from their home, maybe to visit with a friend or even to help babysit. So we're working as they come back that they again would get their meal. Also trying to work with churches, because we feel like there's people, just like there's children, there are people that don't go to that nutrition center that may have the need, either regardless of what age they are. But trying to work with the Bladen Disaster Recovery Team to identify those folks that in the future are going to need some help or may need some help if this continues very long.
Looking for the positive in this situation, I know people are supposed to practice social distancing. How can they help? You know, people that are healthy and that are strong, the ones that, you know, our officials are saying the spread of this is dependent upon us, you know, adhering to the guidelines. How can we help?
Well, there's several ways. Even locally, because our businesses are struggling, buy gift certificates so that when they open back up, you can support them now and support them in the future. Folks that are at home can help write cards to those that are in nursing homes. Start thinking about donating food to the Bladen Disaster Recovery Group, to your local churches, and working with us to help get those things out, and to try to maintain mental health for yourself, to try to go about some kind of routine. The State Department of Public Instruction has recommended that for children that you try to get them up at a regular time and have them go to bed at a regular time, so they will have some sort of normalcy. The same for our older adults, and basically for everybody. But to remember the small things, and you know, as I said earlier, this week the azaleas were beautiful. To look at the positives in a day and what has happened, to me it's a good thing that when we served 2,800 meals, the school personnel did an awesome, spectacular job serving today. That's a bright spot.
Well, I appreciate it.
And I want to add to that, Charlotte, you know, the gift card she's talking about, even if you're not, you know, support these local businesses that might have, or some of these that are having to close tomorrow, and even some of these that their dine-in options have kind of been put on hold for now. Buy gift certificates for these people, these folks that were recommended that kind of stay at home and don't get out unnecessary. Even if you're not buying a gift certificate for yourself, we have places you can certainly call. Any of us reach out and we can tell you where to take those out, because there are going to be people in need that are gonna need gift cards and things like that to get food. So, and just like Dr. Duncan said, you know, reaching out to someone, a card, a positive Facebook post, anything. You never know how that might help somebody.
A telephone call.
Yeah, that's what I just, we had retweeted something the governor had tweeted out. He said, you know, have the students call the senior citizens, and that's a great idea. So.
And I want to say one thing while we're on too. I want the county and your watchers and citizens to know Bladen County schools have been above and beyond with what they're doing, feeding these students, the ends they've gone to get supplies here, bus drivers out driving around, the people preparing these meals at the schools. If you see those people, they certainly need to be commended. They are going above and beyond, and I don't know if Dr. Duncan said this or not, but their numbers have grown from 300 last week when they started this to almost 3,000 people today. And I expect it's going to keep growing. And they've planned out routes to get these meals to people who can't come, curbside pickup, preparing meals. So those teachers, those board education workers, those people that are doing duties that are normally outside, not only the teachers that are helping or having to prepare lessons for students. So these people are going above and beyond, and they need to be commended for what they're doing. They're doing a fantastic job, and man, I'm proud to say that they're part of Bladen County.
Well, thank you all very much. I don't see our viewers I don't see any questions that our viewers have. So I appreciate your time and keep up the good work.
Thank you, Sean.
Thank you.